Hi, I'm Dr. Shawna, and today I'll be talking about teeth extractions. When do we extract a tooth? We usually extract the tooth when it cannot be restored anymore by fillings or dental crowns, and one of the conditions if there is tooth decay, and the tooth decay is very advanced, very large, very deep that we cannot restore it anymore. Sometimes your teeth can get cracked, and if this cracked lines goes really deep and down into the gums, that we cannot save that tooth anymore as well by using a crown, we would have to extract the tooth as well. Tooth which have an infection and you have a really large swelling and there is a large infection in your jawbones, sometimes these teeth can be saved and sometimes they can't be saved. So extractions can be an option in those situations. Your dentist will be able to advise you on that a little bit better based on the condition that you have. One of the most common ways tooth are extracted is due to an impacted wisdom teeth. That means your wisdom tooth is not growing out straight like all the other teeth. It's growing out at an angle, and because of that angle, it causes you a lot of pain and sensitivities, sometimes even causes an infection around the gum in that area because you can't clean it properly. Your dentist might advise you to remove it just for more comfort for you. Another reason a tooth is extracted is due to overcrowding. Now, you will see this commonly when you're going to get braces done, and for some people, the size of your teeth might be a little bit too large for the size of your jaw. So we may remove 2 teeth or even 4 teeth to give you a really nice straight smile. Our main goal as dentists is to save your natural teeth. We will do everything that we can or everything in our power to save your teeth because it's the best thing that you can have in your mouth to function, to eat, to talk, to speak. But in certain instances, like we mentioned earlier, extracting the teeth may be more beneficial for you. So speak to your dentist to know more about it.